Good afternoon. My name is Shirley Manson. I'm your interlocutor for the OET today. Can you say your name for the record, please?
Good afternoon, Shirley. My name is Shane Rodas.
And what is your candidate number, please?
My candidate number is 21055266640.
Thank you. And, you are taking this test as a nurse, is that correct?
Yes.
Thank you. Can I see your ID, please?
Yes, sure.
The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
Okay.
Describe your ability to handle high-pressure situations.
I have always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Discuss your personal attributes that make you especially qualified a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye, or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
Have you ever had to deal with a distraught family member? How did you handle the situation?
It is always very difficult for family members to see someone they love suffering, and I understand that firsthand. During my time at the urgent clinic, I dealt with several family members who came in with a patient who required immediate transfer via ambulance to the emergency department. In each of these cases, I spoke calmly, clearly, and honestly to the individual. I acknowledged the patient's condition and assured the family that the medical team would strive to provide the best possible care for their loved one.
Tell me about a time when you had a conflict with a supervisor. How did you handle it?
In a position I worked in previously, we used a specific method for checking in patients that I felt was outdated and inefficient. At an appropriate time during one of our staff meetings, I made several suggestions that I thought would improve the process. The supervisor was specifically looking for ways to increase efficiency, but disagreed with my opinions about the check-in process. He didn't utilize any of my ideas and didn't change the intake process. I continued to use the old system and, even though I thought our patients would have been served better by a new method, let the issue drop as it wasn't worth having contention in the workplace.
What personal characteristics should a staff nurse possess to be good at the job?
It is important to be organized and have a good memory. A nurse performs the duties quickly, on time, and efficiently. Nurses are sensitive and pleasant with others. Nurses' attitude must not be to simply administer technical treatment mechanically, but to make patients feel as comfortable as possible.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the first role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good morning, I'm Shane Rothers, one of the registered nurses in the hospital.
Good morning, nurse.
For the verification, may I confirm your name, please?
My name is Shirley Manson.
Hi, Shirley. You have been admitted to the hospital due to bronchitis. Is that correct?
Yes, that is correct.
Thank you for the confirmation, Miss Shirley. I'm here today to collect some basic details about you. May I ask you a few questions, please?
Yes, sure.
Basically, I would like to know about your lifestyle. So, let me begin from your home. If you don't mind, can you share some of your family background, please?
Yes, I live with my family. My husband, who is 56-year-old, and our 3 kids, all are teenagers.
Okay, are you living in a city, or near to any industrial area, which is prone to air pollution?
No, we reside in a residential area, and it is located in the outer city.
That is great. Do you smoke? If yes, which category you belong to? Heavy, moderate, or occasional?
I'm a heavy smoker.
All right, for my knowledge, may I know since how many years you have been smoking heavily?
It has been almost 30 years.
Oh, that's really a pretty long duration.
Yes, I know that.
All right, don't be sad. We're here to help you.
Thank you.
Okay, so have you ever had chest infections, or any other health issues?
I often had chest infections.
I'm really sorry to hear that. By the way, for my better knowledge, shall I know, do you have any other habits that may affect your health adversely?
No. Nothing else.
All right, are you under any medications?
No.
Okay, just to go over what we have discussed. You have been smoking heavily for the last 30 years. And had chest infections several times. Am I right?
Yes, you are right.
All right, for my better understanding, may I know the reason for the smoking habit, please?
I have started smoking from my college days, along with my friends, just for fun. When I grew up, it became a part of my life. And I started to rely on smoking to relieve my stress and worries.
Yes, I can understand what you are going through right now.
Nurse, I really wish to stop this smoking, and I have tried many times but not succeeded.
I am glad that you have made the decision to quit smoking.
Yes, I am ready to follow all the suggestions that you provide for me.
The good news is that it is possible to give up smoking, with strong determination, along with some therapeutic management.
But, what should I do for that?
First of all, it is a good idea to avoid smoking situations. And distract yourself from smoking by participating in some interesting activities. Don't forget to reward yourself.
Sure, I will try that.
Good. Along with that, you can use some nicotine gums, which are available in the market during the initial period, which will help you to get a sensation of smoking.
Is it? This is the first time I am hearing about it.
Okay, but it is only for the initial days, until you come over the addiction.
Yes, I understand.
In addition, there are many support groups and plan programs available in the community and in hospital setup, where you can meet and interact with many people who have already stopped smoking, and many who are trying for it.
Actually, when I tried to stop smoking last time, I experienced restlessness and extreme tension. So how can I get relief from that?
Yes, those are some common withdrawal symptoms, which will subside after 10 days. And you will feel great. But, don't worry, we will manage your symptoms with some effective therapy.
I am really grateful. But, I have another question for you.
Sure, you may proceed.
If I quit smoking, will I be able to lead a normal life, without any complications?
I would like to reassure you that many of the complications caused by smoking can be reversed. Moreover, if you quit smoking, you will have more energy, better health, and improved senses. Are you getting me?
Yes, I am. And from today onwards, I will follow all your suggestions and advices, in the best way.
Great.
Nurse, by the way, I have undergone CT scan, and X-ray. Shall I have the test results?
Yes, I have the test result back and, unfortunately, I have to tell you that the results are not good. Your chest X-ray results show a significant growth, or mass in the right lung. And the CT scans reveal inflammation of the lymph nodes in the neck and chest.
A growth. Is it a cancer?
Oh. I am sorry. I don't have the authority to confirm the diagnosis. Our doctor will reach you soon and provide a better idea regarding your condition. But don't get panic. Growth are usually of two types, cancerous and non-cancerous. And to identify that, further investigations are needed.
But, if it is a cancer, do I have a cure?
Sure. There are many treatment options available for cancer, such as surgery, where doctors cut out cancer tissue. The second one is chemotherapy, which uses special medicines to shrink or kill the cancer. Thirdly, radiation therapy. It is treatment with the use of high-energy rays, similar to X-rays, to kill the cancer. And finally, targeted therapy, where we use drugs to block the growth and spread of cancer cells.
So, I can hope for a recovery, isn't it?
Yes, we have specialized doctors. And our hospital is highly facilitated, where you can receive 100% care and management for your condition.
I really believe that I am in the best place.
Yes, you are at the right place, and in the safer hands.
Thank you.
All right, do I need to answer anything else for you?
No, not really for now.
All right, if you have any concerns or trouble, kindly press the call button on your right-hand side. We're here to help you.
Sure.
Okay, thank you for listening to me, and I wish you a very speedy recovery.
Thank you so much for your assistance.
You are welcome.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.